Good morning, everyone. This is Maxine Kane. I'm the founder and president of STEM Atlanta Women, where we focus on enhancing and increasing the talent pipeline for girls in STEM. I am your host this afternoon. I am the event chair for the Technology Association of Georgia Diversity and Inclusion Society event chair. So we are excited to have you join us today. This is a very important topic, and it's the impact of COVID on people of color. And we're talking about the vaccines today. So we've been preparing for this very important event. I tell you, it is a hot topic around the nation. We have some very esteemed panelists who will share information, insights, and expertise with all of us today. And I hope that you enjoy our session. At this point, I'm going to introduce my co-host, Ms. Monique Ennis. Monique will be serving as our engagement director today, and she will tell you all about what that means. So Monique, can you give them a little bit of information about yourself and tell them what you're doing with us today?
Absolutely. Thank you so much, Maxine. We're welcome everyone, and we're really excited to bring a very informative event to you today. I will be monitoring the chat throughout today's event. And we strongly encourage you all to participate. And you can participate in a few different ways. One, by posting questions to the chat. Also encouraging you to engage in the discussions. And also feel free to post any reactions based on the conversation that you're hearing. So this event is really for you. And to maximize your experience over the next 90 minutes, we strongly, again, encourage you to participate. I also want to provide you with a little bit of direction to maximize the view that you're seeing, to get the side-by-side view so that you can see the actual presentation as well as the speakers. In the upper right-hand corner, you'll see a view icon. If you click that, you can click to select side-by-side to see one speaker. If you want to see the entire gallery of participants, including the speakers, you can also click side-by-side gallery. So I hope you all enjoy the event. And with that, I would like to pass it over to Adam Moore, who's the chair of the Diversity and Inclusion Society. Adam?
Monique, thank you so very much. My name's Adam Moore. I am the chair for TAG's Diversity and Inclusion Society. I am also the director of supplier diversity for the newly formed Truist Bank. It is an honor to be here. This is such an important topic for us today as we face trying to bring this pandemic not just to a close, but also to overcome it. I actually am sitting here today talking to all of you as my family and I are all fighting the virus right now. We tested positive last week. So there's a little bit of a bitter irony here talking about the vaccine, but I can't tell you how important it is because really and truly, I have been asymptomatic for almost a week and a half before I had some symptoms finally show up late last night. So really, truly, a very important topic for all of us to take seriously. I thank you all for being here. Maxine and Monique, thank you so much for putting this on and gathering such an incredible group of panelists to talk to us today. And with that, I'd like to introduce Chris Carabinos from TAG's Digital Health Society.
Thank you, Adam. I appreciate the introduction. And as Adam mentioned, I'm the chair of the Digital Health Society. For those of you who may not be familiar with TAG, the Technology Association of Georgia has 23 different societies of about 30,000 members. So the D&I Society and TAG Digital Health, we are partnering on this event. TAG Digital Health really focuses on the application of technology to improve healthcare in the state of Georgia in particular. And so we do a number of things in addition to programming and advocacy at the state level and other levels too. But one of the things we want to do is a lot of this is education. And so we want to educate people around the state, particularly in healthcare and technology communities, but just people in general, about a number of issues. The issue to improve the delivery of healthcare in the state in rural deserts, where there's rural or urban deserts, is a huge cause of ours. But also we want to educate about the healthcare inequity issues throughout the state. So some of those are intended, some are unintended. And so we think this program today goes a long way towards helping educate people of all races about the issues and the opportunities affecting COVID. So we want to promote the use of COVID across all populations in the state. And so that's why we are supporting this. So appreciate Adam and Maxine for the invitation to participate with you. Monique, if you could forward to the next slide, if you will. So TAG Digital Health, just briefly, we have a number of events throughout this year. Right now we have 7 scheduled. This is the second, as you can see, on February 16th. We have some others coming up. You could go to tagonline.org and check out the D&I Society's events, our events, all the different society events. I'm not going to go through these here, but I would like to let you know we have a number of things almost every other month. There's something going on to promote healthcare and digital health in the state of Georgia. And if you go to the next page, please. We are very appreciative of the support of our society sponsors, which includes Azalea Health, Taliant Systems, Integra Connect, Juno EHR, and Kennesaw State's program around Masters of Health Informatics. So these are huge sponsorships that allow us to conduct the program that we have, and want to appreciate people with those companies and CEOs of those companies, many of which are with us on this call today. The next item I'd like to do is introduce Jose Marquez. Jose is the national president and CEO of TAC Latino. That's the Organization for Latinos in Information Sciences and Technology. And he is going to set up the rest of the meeting. Jose?
Hey, good afternoon. Thank you, everyone, for giving us an opportunity to be together on this fine day here in Atlanta. I'll tell you, we are very lucky that we're going to have this conversation, because I think this is one of the most important things that we've needed to have for quite a while. So, good afternoon to all our members and friends of TAG D&I Society, the Digital Health Society, STEM Atlanta Women, and of course, Tech Latino. We're really excited to be here. I'm Jose Marquez. I'm the CEO of Tech Latino, the National Association of Latinos in Information Sciences and Technology. I'm a member of the Diversity and Inclusion Society and proud member of TAG. And so today, my biggest concern is the Hispanic community and the African American community, and of course, the Native community. So we're gathered here to discuss African, Latino, and Native Americans as where are they standing as far as when it comes to vaccines, and what are the myths and some of the ideas that's rolling around there, non-truths, fake facts that are out there about the vaccines. So we need to make sure that we are giving the right information, and the right information must go out to all of our communities. But before we begin, I would like to bring up a new study that shows Latinos are hesitant to getting vaccines. According to a report published by the Brookings Institute, 28% of Latinos say they are unlikely to get shots, citing long-term health issues, side effects, questioning the vaccine's effectiveness. Skepticism appears even higher amongst the Puerto Rican and the Mexican community. Most importantly, the concentration of essential workers in the Latino workforce, we must make sure that Latino community is being reached out to and educated on the needs to get vaccinated. Professor Gabe Sanchez and doctoral candidate Juan Peña, who authored this study, says the federal government needs to ensure accurate information is presented to all of our communities of color. And we recommend the following recommendations to make for all communities. Commission a more in-depth study of the Hispanic and African American community when it comes to vaccine rollout strategies for both adults and children that identify the most effective message that improve trust in the vaccine amongst Latinos and African Americans, excuse me, and the strongest messenger to help the community are these messages, and where Latinos would like to have more information about the vaccine. Use the data to disaggregate this information across important sources of variation among Latinos, as we have done in this brief, to ensure that the community is not treated as a monolithic population, and recognize that Latinos and African Americans have been saturated with many misinformation about the vaccine, which must be countered with factual in both English and Spanish. So thank you for your time. I hope these numbers shared today are helpful to this conversation. And thank you for joining us, all the people that are here, friends of TAG. And now it's my distinct honor to introduce our illustrious panel. And to be very honest with you, I'm looking at this whole panel and I'm saying, okay, why am I here? Because everybody on this panel is so accomplished, and I'm blessed to be here and to be able to introduce them. So my first introduction is going to be of Dr. Jose Moret. Dr. Moret is called the first intergalactic doctor, is an Eisenhower Fellow, Chief Medical Innovation Officer for Liberty Biosecurity, CEO of Ad Astra, Director of Innovation and Chief Engineering Council, Innovation Lead of Hyperloop Transportation Technologies. He's a Senior Advisor to the Director at the White House on Science and Technology, CORD-19 project, and is Senior Advisor to the NASA AI Breathing Space Initiative. He is a member of the Forbes Technology Council, Medical Technology and Artificial Intelligence Officer for NASA iTech, and mentor with MIT Solve. Welcome, Jose Moret. And now we're going to introduce Dominic Wilkins. Dominic is the Vice President of Basketball and Special Advisor to the CEO of the Atlanta Hawks. Dominic is extremely active with local and national charities endeavors. Wilkins has done work with the Juvenile Diabetes Research Foundation, Cystic Fibrosis Foundation, and Special Olympics, Muscular Dystrophy Association, American Lung Association. And in July 2007, Wilkins launched Nick and Newt Full Court Press on Diabetes with a former Speaker of the United States House of Representatives, Newt Gingrich. In March 2010, Wilkins was honored by the Georgia State Legislature as they presented a state resolution naming him the Diabetes Ambassador for the state of Georgia. He is a diabetes ambassador for Novo Nordisk and a world leader in diabetic care. Welcome, Dominic Wilkins. Our next speaker is Dr. Tabia Henry Akintobi. She's PhD, MPH, and is a health equity champion leading our collaboration on the implementation of translational research and participatory evaluations that address health disparities and advance community and population health transformation. She is a professor of community health and preventive medicine and associate dean of community engagement at Morehouse School of Medicine. Let us welcome Dr. Tabia Henry Akintobi. Let's also welcome Benita Harris. Benita Harris McBride is an MPH for the Center of Disease Control, and her job responsibility is Senior Public Health Analyst. But let me tell you, she is everything at the CDC. So we have to welcome her and thank her for taking some time to be with us as well today. Benita was recently appointed to the National COVID-19 Vaccine Task Force. She is currently serving as the Senior Racial Ethnic Minority Population Program and Policy Advisor, and will be responsible for vaccine implementation in disproportionately affected adult populations. Benita is tasked with the improvement of vaccine coverage for underserved populations, particularly members of racial and ethnic minority groups, and the development and implementation of the effort to increase vaccination coverage. And I think last but not least is our hostess with the mostest, Maxine Kane. She will also be moderator for this event. And Maxine Kane is an award-winning people leader changing the way women business leaders and entrepreneurs live, work, and play by doing work that matters in science, technology, engineering, and math. Maxine is the founder and president of STEM Atlanta Women, a nonprofit organization created to enlighten, educate, and empower women and girls about the advantages of global opportunities in science, technology, engineering, and math, and the future skills needed to compete and succeed in 21st century. Sorry. Okay, so with that, I am going to turn it over to Maxine Kane. Thank you, everybody, for giving me your time.
Thank you very much, Jose. We really appreciate you, and thank you for being here. You are definitely wanted and valued. We also thank you for introducing this amazing panel. Rebecca, if you can go back to our why slide, I want to kick off this event really understanding, before I wanted to help our audience understand the why behind this event. Again, if you guys see on the screen, I have the opportunity to participate in an event where Dr. Camisia Corbett, she is the scientific lead for the coronavirus team, vaccine team at the National Institute of Allergy and Infectious Diseases. And I was very impressed with her information that she shared with all of us around the nation. But one of the things that stood out to me was that she said that the vaccination is a community service. It is truly a community service. And we're going to tell you why that is today. Again, the panelists are here to really share information. They're here to share insight, expertise, and to help us dispel this myth of the mistrust and the hesitancy around why people of color are pretty, I shouldn't say all of them, but there's a large number of them that are adamant that they are not going to take the vaccine. And so that's very concerning. So Rebecca, if you can go down to the Bonita McBride slide, we're gonna kick off this conversation with our resident expert and a dear friend of mine for many years, Miss Bonita Harris McBride. And go to the next slide, Rebecca. And one of the things that I've asked Bonita to do is to really share information around the backstory, share information about the foundation of how we got started here. And as you'll see on the screen, I put a comment here around, did you know that at the beginning of 2020, when it became clear that this novel virus was spreading rapidly around the globe, Dr. Corbett and her team immediately got to work. This all started back in 2013, which was kind of the catalyst for the rapid vaccine development. So Bonita, can you talk to us a little bit about that and help our audience understand how we all got started with this?
Good afternoon, and thank you, Maxine. And yes, did you know that coronaviruses are not new? The world was able to develop the COVID-19 vaccines so quickly because of years of previous research on related viruses and faster ways to manufacture those viruses. Creating a vaccine in under 1 year is no small feat. While the coronavirus pandemic made a new normal of wearing masks and physically distancing, it also spurred global cooperation for vaccine research and distribution. Under normal circumstances, making a vaccine can take up to 10 to 15 years, and that's because of the complexities of the vaccine development. However, amid a global pandemic, time was not a luxury the world could not afford. Researchers quickly mobilized to share the coronavirus's data and other scientists. Research were not started from scratch with this COVID-19 vaccine. When they learned about SARS-CoV-2, the virus that caused COVID-19, it is a member of what we call the coronavirus family. And according to the National Institute of Allergy and Infectious Diseases, there are hundreds of coronaviruses, including 4 that can cause the common cold, as well as the coronaviruses that sparked the SARS, what we know as the severe acute respiratory syndrome back in 2002, and the emergence of MERS, the Middle Eastern respiratory syndrome, which we saw in 2012. Scientists have been studying coronaviruses for over 50 years. This meant that scientists had existing information, data, and guidance on the structure, the genome, and the life cycle of this virus and types of those viruses that are similar to it. This data and research established a strong scientific foundation that allowed the world to quickly develop a vaccine for COVID-19. Studies show that the vaccine are effective in getting COVID-19 quelled. An expert thinks that that a COVID-19 vaccine may help you from getting the virus. The vaccine is not giving you the virus. It is not altering your DNA. It teaches our immune systems how to recognize and fight the virus that causes COVID-19. It typically takes a few weeks after vaccination for the body to build immunity or protection against it. So that means that you could probably still catch COVID after getting the vaccine, but it may not be as severe. Although the COVID-19 vaccines are effective at keeping you from getting sick, we're still learning a whole lot more about them. All COVID-19 vaccines currently available in the United States have been shown to be highly effective in preventing COVID-19. We ask that even if you are vaccinated against COVID-19, that you can still be exposed to it. After exposure, people can be infected or carry the virus that causes vaccine. Or, as Adam mentioned earlier, you may be asymptomatic. And it is for these reasons, even after vaccination, that it's important that you protect yourself from others from the vaccine. Wearing a mask to cover your nose and your mouth, staying at least 6 feet from others, avoiding crowds, avoiding poorly ventilated spaces, and washing your hands often. These combinations are very useful in helping you mitigate and prevent the infection of COVID-19. I think that these things are very important. We know that COVID-19 has had a detrimental effect on Hispanic, Latinx, African American, Asian populations, and those other populations that deal with chronic diseases such as diabetes and hypertension. CDC has been working very hard to investigate the effectiveness of COVID-19 and have a webpage dedicated to information about racial and ethnic populations as it relates to the COVID-19 vaccine. In addition to that, we are funding programs and working with community-based organizations and some of our philanthropic partners to ensure that there's equitable resources as well as access to information that will serve to reduce COVID-19 related health disparities, to increase testing, contact tracing, isolation options, and preventive care and disease management as it relates to COVID-19 in these populations. We also are working to ensure equity in nationwide distribution and administration of future COVID-19 vaccines. And as Maxine mentioned earlier, I am working on that task force. And believe me, it's not an easy job, but we are dedicated to ensure it is important that you have people that look like those that are infected and impacted by the vaccine working to reduce this. And I'm honored to serve in that capacity. We're also working to implement evidence-based policies, systems, and environmental strategies to mitigate social and health inequities related to COVID-19. We're working very hard to reduce COVID-19 associated stigma and implicit biases. And we're expanding cultural responsiveness and application of health equity principles among an increasing diverse COVID-19 responder workforce. So you can see CDC has mobilized, and we're working with our community and people like you to ensure that we are equitable in this disease, in this fight, and ensuring that the vaccine is available to all. And as I mentioned, coronaviruses are not new. This one is just similar to the others that behave a little differently, and we're working hard so that we can understand it more and give you a better understanding. So the work of Dr. Corbett and others set those foundations firm in place that allow us to make equitable decisions as it relates to prevention, healthcare, and policies around COVID-19. Thank you, Maxine.
Thank you so much, Benita. That was very, very informative. Wow. Wow. You guys are doing some amazing work at the CDC. And so we want to continue to talk about the why. So Rebecca, if you can go to Dr. Akintobi's slide, and there's another why slide that I want to have her to talk through as we're talking about the whole concept of why. And so next slide, please. So Dr. Akintobi, as you can see, I put a note here that COVID-19 is not an equal opportunity virus. Indeed, it's shined a light on America's pandemic of inequality. Can you talk to us about that?
Absolutely, and thank you, Maxine, and for everyone who's listening in, for making the time to be a part of this discussion, and also to share your questions and your concerns about this issue. The more we can create a safe space to have these tough conversations, the more we can come up with solutions that really are responsive. So I represent Morehouse School of Medicine and two initiatives that are designed really to address exactly this question. First is a movement called Georgia SEAL, which is the Community Engaged Alliance to Mitigate COVID. And it is strategically focused on conducting urgent community engagement and outreach related to engaging Black and Latinx communities in the conversation surrounding mistrust, vaccine trials, vaccinations, and hesitancy. And then we want to do what we can to really facilitate their participation in vaccinations and vaccine trials. So I'll just start answering that question with what we know. We knew that back in the summer of 2019, before there was a COVID-19, that Black and Latinx communities were not running to be at the front of the line to be vaccinated or participate in a vaccine trial. And so they are not sprinting to do that now that we're in the era of COVID. And so some of that has to do with the atrocities that folks who have been in research or in the medical profession, those things that happen, which really are about people with less power being taken advantage of, being hurt and killed in the spirit of research that was not protected. But we know that other people, particularly African Americans, are also concerned with some of the things that Benita talked about, and that is the fact that it looks like this vaccine came across super quick, and they want to be sure that if they participate, they will not be subject to some of the ways that history can repeat itself. So it's always important to know where we have come from. So what we know is that racial and ethnic minority populations have historically borne greater hospitalizations, illness, and death as a result of any public health emergency. So this goes back to things like H1N1 and the Zika virus epidemic. And so this is in part due to what we call a disproportionate burden by way of social vulnerability. So social vulnerability in a nutshell is that individuals and community characteristics, these characteristics that affect the capacities to anticipate, confront, repair, and recover from the effects of a disaster. And so it's important that we keep in mind that, just as was shared earlier, COVID-19 is really just another case in point of how those things that existed before, particularly for African American communities, we've been reminded of them, or they have been exacerbated due to the pandemic. So the other thing that we need to keep in mind that is not brand new, and that is the COVID-19 pandemic is intensified by long-standing income inequality between non-Hispanic, whites, and racial and ethnic minority populations. So this includes both Black and Latinx communities. But what we know is that when there is increased income inequality, once that coexists with other disparities related to income, like health insurance or the lack thereof, employment or unemployment, education, social justice, access to quality health care, All of those things are directly connected to income. And where income inequality exists, public health pandemics marginalize Black communities even further. And it really requires us to consider a very thoughtful public health response. I'll bring up two other things that I think are important to consider. And that is that African Americans are twice as likely as non-Hispanic white Americans to die from heart disease. And remember, cardiovascular issues are connected to increased complications related to COVID-19. And they're 50% more likely to have hypertension and or diabetes, right? So diabetes, its onslaught on the immune system. For people who are diabetic, their immune systems are already depressed. And if they are not managing their condition, as Mr. Wilkins and others who are champions of diabetes prevention and management are, the onslaught, when we think about the severity of COVID, how it enters the lungs by way of certain receptors that can compromise oxygen and carbon dioxide. I'm using a lot of technical terms, but at the end of the day, those people who you've seen on TV or maybe even in your own family who've been on respirators, the diabetes, the increased incidence of diabetes and other cardiovascular issues are explained, particularly for those who have not managed them well. They help us to understand why those pre-existing conditions, particularly for African Americans who are more likely to have them, that also helps us to understand why chronic conditions for Blacks can equate to increased hospitalization, death, and illness related to COVID. So I'll say this last thing and then stop here. We must not forget to mind our mental health matters. And so there are interrelated COVID-19 stressors that are not just based on things that may have existed before, right? But there are pandemic-related factors, including post-traumatic stress disorder, confusion, and anger, not to mention some of the things that were unique this year when we think about childcare and safety, elder care, food insecurity, and all of these things related to the whole notion of sheltering in place or not being able to do that. So for African Americans and Black communities, the urgency of our leadership in response to COVID is complicated and requires all of us to do something. We know that if Black and Latinx communities are not a part of the vaccine trials to prevent the intensity of COVID, that we will not really understand what works best for everyone. And so we can sit on the sidelines as leaders and as family members. And I'll just say I was thrilled to learn that my dad, who thought COVID was not a thing, finally got his vaccine. Or we can do something about it collectively. So happy to be a part of this discussion. And not only the why, but the now what with all of us is so very important.
Awesome. Thank you so much, Dr. Akintobi, for sharing that. And you mentioned these underlying conditions that are really impacting the African American and people of color community. And we're going to go to Rebecca, to Dominique Wilkins' slide, because as she mentioned earlier, diabetes is certainly just really impacting us significantly. And Mr. Wilkins himself is a person that suffers with diabetes, and he's going to talk to us about his story. He's going to talk to us about how it has infected him and others who are suffering with diabetes. Next slide, Rebecca. And so, Mr. Wilkins, one of the things that my thoughts were around this topic was there is a historical precedent in connection to why Black and Brown communities were so impacted by this pandemic. You'll see, I want you to explain why those with pre-existing health conditions such as diabetes are at risk to becoming ill with COVID-19. And a lot of that goes back to what Dr. Akintobi was sharing. But can you please share with us your story? And how did you know that you had it? And how are you protecting yourself now in the midst of this pandemic? Yeah, you're on mute. You got to unmute yourself.
Well,
There you
first of
go.
all, thank you, Maxine. Always good to see you, love. For me, diabetes run rapidly in my family. My father and grandfather had diabetes, and they were type 1 diabetics. And being a guy who trained this basically his whole life, I've always was into making sure that I was in the best of shape and encourage others to be in great shape. And so, I've always been a guy who stayed ahead of the rest. And I noticed something towards the end of my career, that I had a couple of episodes where my sugar level got too low, where I was sitting down at a restaurant, I couldn't get up. And I remember my brother said to me, he said, "Big brother, you okay?" I was like, "Yeah, I'm okay. I'm just coming down for the game." He looked at me and said, "No, something's wrong." And I ignored it. And that's what happened with most people who are dealing with diabetes and know they have some problems. They ignore it, and all you're doing is prolonging the inevitable. I remember going to the doctor a year after I retired, and he took some tests. I wasn't sick or anything. I didn't feel bad. I just hadn't had a checkup in a long time. And I remember he took some tests, and he took 2 hours to come back into the room. And he said, "I got good news and bad news." And I said, "What's wrong with me?" He said, "The good news is you're not dying yet." And I like, "What does that mean?" And he said, "Don't be alarmed. The bad news, you're a diabetic and you have to have a lifestyle change now." And I remember saying to myself, I'm not going to let diabetes do to me what it did to my father and grandfather, who both died from type 1 diabetes, that I was going to look at it as another opponent that I compete with. And I said, as long as I make the lifestyle changes, do what I need to do to manage my health, that I can stay ahead of this, and I'm winning. And I remember getting back to doing some things I used to do, is training, eating right. I've taken stuff away from my diet, and I lost 34 pounds in 2.5 months. I just got back to doing some things that I used to do. And I've kept it off for the last 21 years. And so one of the things that I decided to do is I started to go to this luncheon, and Newt Gingrich was speaking. And Newt Gingrich at that time was a big champion of diabetes. I thought this is the first time I can get a chance to talk to an official about diabetes, and hopefully that he can give me some insight on what my next moves are. So when I met him, he was very impressed about the conversations we had about diabetes. And the next day he called me and said the thing that impressed him the most, that a guy came and talked to him, was an athlete, and it wasn't about basketball, it was about healthcare. And so we started this campaign called Newton Leaks Full Court Press on Diabetes, which gave people a playbook that they could use to help manage their disease through diet, exercise, and medication. But the hardest thing for people who are dealing with diabetes is to accept that they're diabetic. And so people are very afraid of what they don't understand. And that's what happens. That's what's happening with the COVID-19. They're not really sure that they're getting the right information or clear information. I think that's the biggest problem, that people are not told the truth or full truths. And diabetes is one of those diseases that for many years they hadn't been told the truth. So my whole mission is to teach and educate people that it's okay to be affected by something like a chronic disease. It's what you do now that dictates what you ultimately become in the future, and that's management. And I say all the time, the only way we can cure this disease is one person at a time, one community at a time, and one city at a time. Until we find an actual cure for diabetes, your cure is management. That's your cure. And I'm living testament that if you do the right things and you take care of yourself and not buy into the myths of what diabetes really is, you can live a healthy life like anybody else, because diabetes is just a roadblock. Roadblocks are not meant to stop you, just to slow you down a bit, so you can step back, look at your health and say, hey, I got to find a way to get over it or around it. And that's how I live my life. I live my life in trying to find solutions. And now we're faced with this COVID-19 pandemic. It's the same principles. It's what we do now as a community and a nation to come together to find a healthy way to fight it. First of all, by making sure that we stick with the protocols, stick with the structure that's in place that's going to help us live healthier lives, and make sure that we continue to educate our family and friends in our neighborhoods, and that if we can all come together and live this way, that we can get through it. but it's going to take some time. It's going to take some commitment. And it's going to take the government telling us the truth about what this really is and how do we manage it and how do we get vaccinated? Because right now it's a nightmare just to say to Georgia to get vaccinated. And so until that happens, we have to make sure as individuals in that community that we stay ahead of it, you know, by doing the right thing. Management, management, management. That's how we cure this disease.
Thank you so much. And thank you for your transparency and sharing your personal story with diabetes. I'm sure that there's someone in the audience that really values and appreciates that. So thank you so much. Rebecca, we're going to go to Dr. Moray's slide. And again, go back to the next slide before that. Yes. So Dr. Moray, I tell you, you've heard a lot so far from Benita, Dr. Tabia Akintobi. You've heard from Jose Marquez and most recently Dominique Wilkins. And they've all talked about these underlying conditions and the impact that it's having on people of color. But this slide is where I really want you to elaborate. It's all about the most vulnerable people of us all, people of color, are suffering the most. We are suffering the most. And there are a host of reasons why this COVID-19 is killing more people of color. Blacks, Latinx, people tend to be of lower socioeconomic status due to structural inequities, as Dr. Akintobi was sharing with us. So can you tell us why not take the vaccine? Why is there so much fear, mistrust, hesitancy, especially with those of us who are suffering the most? Can you share with us from your perspective as a doctor?
Sure, and thank you very much for everyone that's attending. Thank you to TAG for the opportunity to come speak to you today. I apologize if my connection's a little poor. I'm actually in clinic today, so having to call in. So if I get pulled away suddenly, I apologize if there's some emergent thing that I have to take care of and one of my partners can't handle. But this topic is really important, and Dr. Akintobi speaks to a lot of the reasons as to the underlying issues. It is this inequality that stems primarily, it's multifactorial. It's been systemic inequality that's been passed down through, that's been multifaceted, right? From Jim Crow laws to redlining, things that have been consistently been holding back underserved and minority communities really for generations within this country. And those things are highlighted when the system is stressed. I write in a recent MIT article that systemic inequality tends to beget systemic inequality. Systemic inequality tends to beget other types of inequality, whether in technology and healthcare, and it just has so many confounding ramifications. It's like a pebble in a pond where the ripples keep going out and out and out and being affected by the individuals and the families of the individuals that are facing those inequalities. And it really stems all around the central aspect of this socioeconomics. If you tend to have be of a lower socioeconomic status, you tend to not be able to have access to good nutrition or access to higher levels of education or access to the best types of healthcare. Oftentimes, people of underserved communities and minorities, African Americans, Hispanics, Indigenous, we tend to not be able to have access to good healthcare. We tend to have to be those frontline workers that don't have the option to be able to sit from home and transition to a life of Zoom meetings, right? You have to be out there. You have to be working. Why? Because that is your source of income for your family. That is your source of food. That is your source of sustenance. And more often than not, underserved minorities tend to be those frontline workers. They tend to be the people that don't have access to good healthcare. They tend to be people that, because of their socioeconomic status, they have to live in multi-generational households to support each other. That's why family is so integral to underserved communities. That's why that's something that's always been something very similar across Hispanics and African Americans, you know, similar to family, similar types of things that we tend to do around brothers and sisters. And it's something that has been placed upon our societies by the system, and it's something that will continue to perpetuate if we don't try to stop it in some aspect. And then you asked specifically as to the fear or the mistrust. Well, there's mistrust because of historical reasons, and I saw there a lot of aspects in the chat. There's validity to this mistrust because underserved, marginalized communities, the people that live on the borders of society that the system has caused them to live in the border society, often get dumped on by society in so many ways, whether it's access to the banking system, access to higher education, equal access to being able to eat at restaurants, or all sorts of other things that have been caused by racial inequalities. So there's, in healthcare, I'm a physician, but medicine has not been kind to underserved communities, not just in this country, but in others. I mean, healthcare has often in medicine, there is blood on the hands of physicians and of researchers, of PhDs, of things that they have done to underserved communities, regardless if it was due to race or sexual orientation. I mean, this has something that's been perpetuated throughout history, and those things echo through time. And it takes a while for those things to be remembered. And specifically with Hispanics, the other issue that we tend to face is that, we're not monolithic, just like there's no real culture that's monolithic. And you have Hispanics that come from different countries. You have Hispanics in the same household that might be of different status when it comes to legality here in the United States. And you have this fear of what it means to interact with the system, particularly with the recent administration and with kind of the animosity towards Hispanics, animosity towards first-generation immigrants here, regardless of how they came to the country. So there's that just general fear of the system. So if you access the system, then you're afraid that the system might fight back or the system might cause harm to you or your loved ones. So Hispanics and other people of underserved communities tend to be afraid and weary of accessing the system. I think this is why Dr. Akintobi and a lot of CDC initiatives are focused so much on outreach and education and speaking to these communities and trying to elevate the knowledge of, hey, this is okay, this is important, this is a way to help. And I think that's the biggest thing that it takes. It takes education, it takes conversations, it takes honesty from the system itself also to be able to say, you know what, we have done many mistakes, many systemic mistakes, and it's not the people that are currently alive, right? A lot of the systemic inequality, they did not perpetuate it themselves, but you've inherited it. And just like in any system, if you come into the system and the system has caused problems, we're not saying individuals have done it, but you've inherited a broken system. And it is now, even though you did not cause that broken system, just like if you came into a company or a nonprofit and there were issues with it that happened before from other executives and other leadership, well, now you're a part of that system. And the onus and the responsibility is for you to fix and make right the issues that have been caused before by others. So are there other alternatives to vaccinations? No, realistically, there are countries that have done well without vaccines, right? There are countries that have done really well with being able to completely stay apart from each other and be able to mask and be able to respect these things. But the problem is that to be able to have that to be effective, it has to happen at the very beginning. You have to be very aggressive with social distancing. You have to be very aggressive with masking and other types of protective alternatives. And if you do that at the very beginning, then you do have the ability to actually not really require vaccines, but we did not. I mean, the United States of America has been one of the most abysmal responses to this coronavirus pandemic since the beginning. And now realistically, it's so wild that there's so many infections within this country that vaccination is really the only way to really get ahead of it. Because now we're starting to see these variants, right? The South African variant, the UK variant, the Australian variants. And as far as we know, there's some mixed data, but we're hoping that the vaccines, especially the Pfizer and Moderna, still have some good protection from it. And it seems so far, yes, but we still have some more testing to do. But the longer a virus gets to propagate within the society or even within one individual system, the more likely there's going to be evolutionary mutations, right? Evolution is constantly happening. We know that this is how we developed this novel variants. So the longer it can go without being controlled, the longer it can propagate, then the higher likelihood it will develop a new type of mutation that's going to require a booster or something else. So if we were in a different situation, if we were at the beginning of this, vaccines may not necessarily be needed, but we are at a point where the vaccine is a must. And regardless if you've had it before or not, everyone needs to be vaccinated, because we know that we need to get to a certain number, a very high number, so we can get this herd immunity. I myself have been vaccinated. I got the Pfizer vaccine. My parents, who live in Florida now, they've received their first dose. They're obviously they have me as a physician who's been constantly telling them that you got to get vaccinated, you got to get vaccinated. But even within our own family, we have family members that have been telling them, oh no, don't go get vaccinated. They don't trust the system. They don't trust the issues that have been being propagated. So it's a heavy ordeal, but we all need to work together. And I think the biggest thing are things like this, education, and getting the word out there and reaching those communities and telling them that it's okay and this is the importance. But the other thing that we have to think about is people from marginalized communities, underserved communities, Hispanics, African Americans. We have the other divide that comes is the educational divide. So being able to speak to those communities in their own language, which is a very big important factor, and in the way that they will understand is also very important. So making sure that we're having the correct conversations with the correct groups of people in a way that they will be able to understand it and not be condescending, and also be something that that's approachable to them, that they will want to be able to do it. Because there's this thing about family, the first responders, or the people that are working the fields, people that are working the restaurants, people that are working at the Krogers and the Albertsons, they need to be out there and they need to be protected so that they don't take it back to their parents or their kids in their homes. So those are the big components. I think one last point I'll say is that, we talk about socioeconomic status, but in healthcare, for so long, healthcare has been, a lot of people push back. Oh, we don't want to spend the money that we need to be spending on healthcare that other advanced countries spend because it's too expensive. It's too expensive. Well, guess now this is very poignant that healthcare is tied so much to economics. And look what happens if you don't put in the time beforehand to supplement a strong healthcare system. It actually does affect your GDP. It actually does affect the economics. So if it's showing light that there is systemic inequality in healthcare that we need to be propping up. And if we don't, then we have these kinds of ramifications that are brought to light during these times of struggle like a pandemic.
Wow, that was a lot. That was a lot. Oh my God, you really hit the nail on the head, Dr. Moray. I'm telling you. So unfortunate right now, the times that we're in, and we certainly need more events like this to bring education and awareness to our society. So before I turn it over to Monique, it looks like we have a lot of chat and questions going on, but I have a question for Dr. Akintobi before we turn it over to Monique and really engage our audience. I know that they have lots of questions for the panelists, but Dr. Akintobi, can you tell us, I know that you are the director for community engagement, and can you tell us what is Morehouse School of Medicine doing right now, or what do you recommend that we do as community leaders to really get the word out and share a lot of what Dr. Jose Moray was just talking about? Tell us what you guys are doing relative to community engagement, and what do you think we need to do more of going forward?
Right. Well, I'll start by saying that, there are some things that have happened by way of COVID that actually have been good, dare I say, right? So the fact that we are, things like Zoom and convenings like this have kind of democratized the access to this type of information, right? So over the past 5-6 months, getting together influencers like Mr. Wilkins, those who are leading in STEM, etc. Communities have access, right, to be able to have these conversations with people that they may have not been able to engage, or that they didn't have the transportation to be able to come to a talk. So we have a space and a reach that we've not had before. So I think that these conversations, the safe space for people to do more asking than we're talking, is very important. But I will say a couple of things that Morehouse School of Medicine is doing. One is to really look at how we can encourage Black and Latinx communities to get tested and also get vaccinated or participate in a vaccine trial. And so we have a collaboration with Emory University, Georgia Tech, and most importantly, federally qualified health centers across the state of Georgia. For those who don't know, FQHCs are designed to serve those who are of lower socioeconomic status, have co-occurring pre-existing conditions. So we're working with those federally qualified health center leaders to promote testing and vaccinations for folks who are at risk of or who are diabetic, that sweet spot of risk that we need to address, right? And so we're working with the National Institutes of Health and CDC to give community leaders like those who are listening and those on the phone social media tweets, flyers, and materials that they do not have to create from scratch to talk about the myths and facts related to COVID, to talk about vaccines, vaccine trials, but also to let them know where they can go when they are ready. And so I think that's a great resource, and I'll put information in the chat so that you can reach out to us for information that you can have to create those conversations. I think it's really important that we acknowledge our own hesitancy. So Dr. Murray shared that he's been vaccinated, and I have as well. But I'll say that many in my family and those who I believe I have influence with are hesitant, and many of them are in healthcare, right? And so we need to acknowledge that we are also getting there when we can be transparent about where we are in this process, and even do like Adam did and share when we are actually going through it. You know, I had a household where my 13-year-old was one who was going through it, and we had to make sure he was psychologically, pumped up while he was trying to figure out where he got it. So even those of us who know have had experiences with this. And I think it's been a great leveler and a great way for us to make sure that at the end of the day, it's our humanity that has been the common denominator. So when we can be transparent, when we can share resources like Morehouse School of Medicine is doing through Georgia SEAL, as well as the National COVID Resiliency Network that allows anyone to plug in their zip code. And when they plug it in, wherever they are in the US, they can find out where they can be vaccinated, get social services, mental health services related to COVID. Education and linkages matter. And so I'll share that information in the chat, and we're pleased to be a resource and a collaborator with you as we continue to have these important conversations.
Thank you so much, Dr. Akintobi. That information is critical. I certainly will make sure that I am, leveraging that information for the STEM Atlanta women community as well. So I'm going to turn it over to Monique. Monique, I see that there's a lot of chatter going on, right? So tell us what's going on in the chat. And I know that our panelists are ready to receive some of these questions.
Thank you, Maxine. We're fortunate enough to have a very engaging audience today. So high participation, a lot of questions that I have queued up. We're going to try to get to as many questions as we can. So let's jump right into it. I'm going to try to summarize. There were some questions that were multiple requests from different people. So I'll summarize as much as I can here. One question is, if one has previously been tested and continuously tested negative for the vaccine, or if you've already contracted the virus, is the vaccine still needed? So again, if you've been previously tested for the virus, or you've already contracted the virus, is the vaccine still needed for you?
So who is that question directed to?
I would direct that to anyone on the panel, whomever feels comfortable answering that one.
All right, Benita McBride, would you like to take that one?
Shaking my head, yes, it's most definitely needed because of the different variants of the virus and the fact that, you can become infected again with COVID-19. I know Dr. Murray may have some more clinical information to share, but because of the different variants and the different phases and the different symptoms that people have, there is an opportunity for you to be affected more than once with the COVID-19 virus. So it's important that you do have the vaccine, from my point of view.
Dr. Murray?
Yeah, no disagreements with Dr. McBride. Completely concur. You need to have the vaccine regardless if you've been infected. There's a lot of good data as to why this is. We see that the data shows us that people that have been vaccinated have multiples increase in antibodies compared to people that have just been infected. So the vaccine actually protects you much stronger. We also don't know, just like as Dr. McBride mentioned, there's hundreds of coronaviruses, and if you've ever had the common cold, you've probably had a coronavirus. There are others as well, but just like, as little kids and adults, you can get the common cold again, because although it does protect you once you have it once, eventually your antibodies go away. So you need to get you can get reinfected with a common cold. Same issue here. We don't know exactly how long when you get naturally infected it'll last. And we do have good data right now as to how long the vaccines are lasting, and we're continuing to study those. So we have a lot more systemic data to understand how long that lasts. So it is important to get vaccinated, even if you've been infected before, and also if you've tested negative. And even if you've ever had the common cold, you've probably had a coronavirus. There are others as well, but just like, as little kids and adults, you can get the common cold again, because although it does protect you once you have it once, eventually your antibodies go away. So you need to get you can get reinfected with a common cold. Same issue here. We don't know exactly how long when you get naturally infected it'll last. And we do have good data right now as to how long the vaccines are lasting, and we're continuing to study those. So we have a lot more systemic data to understand how long that lasts. So it is important to get vaccinated, even if you've been infected before, and also if you've tested negative. And even after, as Dr. McBride mentioned, even after you get vaccinated, though, it's still important to socially distance, and it's still important to mask, because we still need to keep up those other barriers as well until we reach that herd immunity level.
May I add one thing to that? And I so appreciate all that's been shared. I want us to ensure that we also, and this is something that Morehouse is promoting as well with many across the state, the importance of Black and Latinx communities considering participation in a vaccine trial. So the vaccines that have been made available for emergency use, including Moderna and Pfizer, which is the one that I got, they first were vaccine trials, right? And this is where, after involving thousands of people, they found that the people who participated and got those vaccines that they were testing were less likely, as Benita talked about, to be infected, or the severity was much lower. So there are therapeutic vaccine trials, meaning people who have gotten COVID can participate in those trials. And through that, they can also figure out how they can survive effectively. And I think the other thing to add is, with vaccine trials, you are more likely to have the opportunity to get vaccinated, right? So as was discussed earlier, we have a challenge of the demand. People want to be vaccinated, and the lines and the demand is greater than the vaccine distribution. So participating in a trial increases your odds of being able to get the vaccine. So that's a way to help to understand your risk, or one's risk as a Black or Latinx community resident, but you also are pushed up on that list towards getting the vaccine. So just to be sure, we make sure that we promote that opportunity as well.
I did see that. Can you tell us, what does it mean to participate in a trial?
So was that for me? Okay, so I'm also going to put information in the chat, because we have great resources for what that entails, right? So when you participate in a trial, it's voluntary because of all of the historical things that happen, but you will get information on, of course, being officially consented, and you will participate as either one who gets the vaccine, that's being tested, or you might be a part of the placebo, so you may not get it, right? And so you are followed by way of a research team that has clinicians and researchers on it to find out how you fare or how you are responding following participation. You are intentionally followed over time. That means you're going to get calls by community health workers and other clinicians, because we want to ensure that the benefits that Dr. Murray described, that they continue over time, right? So it is a long-term relationship, speaking of community engagement, to see how you do following participation in this. So keep in mind, things like Pfizer, things like Moderna, they were subject to the same process and now are openly available and have proven to be effective. And so I'm also going to put information on the chat on how you can learn about what vaccine trial participation is. Information is power. We want you to have what you need in the amount that you need it to be able to make the best decision for you.
Awesome. Thank you so much for sharing that. Monique, excuse me, as it relates to questions, do you have questions for Mr. Wilkins? I know that he has a very important meeting that he's going to need to jump off about 1:15. So do you know if there's any questions for him?
Absolutely. Mr. Wilkins spoke so eloquently about the vulnerable community of those with diabetes. So a follow-up question to that. How equitable are we distributing or ensuring that distribution of the vaccine will take place for the most vulnerable, such as those with diabetes? Anything else to add to that?
Well,
That's a great question.
Dominic, if you need for Dr. Akintobi to talk about the distribution, I'm not sure if you have that insight. She can kind of back you up.
No, I don't have that insight, but I can tell you, that's from experience and dealing with people with diabetes. It's moving very slowly as far as the activations and really getting the community and making available and opportunities for people of color, in these communities. And the doc could add a lot more from a clinical standpoint, but we've seen the kind of snail's pace that's being displayed in these communities, and there needs to be more concentration. It needs more involvement and care in these communities, because that's where it starts. It starts from these communities and then it branches out. But if we don't show enough sympathy and empathy for those communities, man, we are missing the boat. And we've done that time and time, because a lot of this is not new. They're just taking this vaccine to shed more light on it, but this is not new.
Right, Dr. Akintobi, do you have any insight to that?
Yeah, so I think we are in a unique place where we can do it right or not, right? So Morehouse School of Medicine spent the month of January having vaccination Saturdays. And we started by having some of our civil rights icons like Ambassador Andrew Young and now the late Hank Aaron to do a PSA connected to our Georgia SEAL work to say, I'm modeling as a super senior, 75 plus, that this is important and you should consider it. From the time that PSA went live on a Tuesday to a Thursday, we had about 800 inquiries of people who wanted to be vaccinated. That line or that list has gone to 9,000. So the issue now is, once there is the right messenger and the right message, is our system ready for those who are no longer hesitant, right? And so I think that is the opportunity and the pressure that we're putting on our state public health office. We had Governor Kemp as well as Toomey at Morehouse School of Medicine just last week, Thursday, to say the demand is here, the trust has been developed. You all need to come on and come through because the community is ready. So right messenger, trust has been established. Our system now needs to be ready.
Wow, thank you so much, Dr. Akintobi and Mr. Wilkins. Is there anything else that you would like to share with the audience or any of the panelists relative to what you would like to see us do differently before you leave us today?
Well, I think you guys are doing a great job of really being given informative information to people, because this was very enlightening for me to hear a lot of you guys talk about the vaccine, how it's being distributed, what it's all about. And so education is key. And so I would say keep, putting the education and opportunities out there for people. I always believe in when people have the right information, you have the tools to help yourself. And that's what we want to continue to do, to give the people tools to help themselves. And I think you guys are doing a great job of what you're doing and getting information out there and staying very informative with the community. So I would just say keep doing more of what you're doing.
Thank you. And what about our young people? As Dr. Akintobi was sharing earlier, that a lot of our young people are just not where they need to be relative to their willingness to take the vaccine.
Well, again, I think people are afraid of what they don't understand. And, when you look at this vaccine, and it's millions and millions and millions of vaccinations that's going on. So, the government's not trying to kill everybody, so it must be working. And so, this, again, the lack of information for particularly people of color, and this younger generation, there's this entitlement attitude that they have, they're stubborn. And so you got to basically spoon feed some of these kids and get them to understand that it's okay. It's okay, to take this vaccine. I'm doing a vaccination with my mom next week, and just to show people it's okay to take it, because, we got to have all the tools that we have at our disposal to help us live better. And, through this pandemic, I've had at least 12, 15 people who've died, 4 of which is 2 high school teammates and 2 college teammates. And one of my college friends is on ventilators right now, because, they feared what they didn't understand. And now he's fighting for his life to, get through this. So this is serious out here, and we got to take it seriously.
Hey,
Absolutely.
I think Benita Harris McBride wanted to add some additional comments to that as well.
Dominique?
I'm sorry, Benita Harris McBride, did you want to add a couple of comments as well?
Certainly. I wanted to add to what Dominique and Tabi talked about in terms of the tools and resources. Right now, CDC is in the process, or have been in the process, of making sure that those tools and resources are at the community level and that they are community driven. And we are doing it in a much more rapid way than we have in the past by funding community-based organizations and partners throughout the US. Normally, it takes about 8 to 9 months for a funding mechanism to get through CDC. On this task force, we have spent the last 60 days writing a request for proposal, getting the request for proposal out, conducting listening sessions, and I'm happy to share that we have funded 7 national organizations as of the first week of February. We just had a partners meeting with them. They are the NAACP, the National Urban League, the National Council of Negro Women, UNIDOS US, National Hispanic Alliance, Health Alliance, the National Council of Black Negro Women, and Northwest Portland Indian Health Board. Earlier on, when we saw that there were hot spots in certain areas where we saw things such as lack of access to healthcare, lack of access to food and resources, and there was a cry to deal with some of the things that were happening with our HBCUs. At the time, my office, the Office of Minority Health and Health Equity, were able to work in tandem with the CDC Foundation to fund those hotspots. We were able to fund, and they're still funded, up and running, doing community engagement and getting this information out and dealing with access and trust. They are Albany State University that serves the Albany Metropolitan Statistical Area. We funded Jackson State University and also the Medical University of Mississippi to deal with the rural and urban information and lack of access there. Jackson State has had a series of town hall meetings where they've invited Morehouse leadership to participate in that. I think Dr. Stephanie Miles Richardson from Morehouse participated. They are doing testing at Jackson State in tandem with the University Medical Center of Mississippi. We also funded Xavier University. Xavier University has been working in the community around community awareness, been working with their state health department, along with other organizations such as Home Depot and others to make sure that access is available, but they're also taking this opportunity to educate. We also funded Tulane University because there's tropical medicine of Tropical School of Public Health, and they have been working diligently in the community to also do the same. So we started with community engagement because we believe that it starts with the community first. We needed to have had those listening sessions to hear exactly what the community needed. And what we're doing with the next phase that we're talking about, the 7 that we just funded, is that these are national organizations that have affiliates and jurisdictions throughout multiple states in the United States. And we are able to work with them and their satellite partners to make sure that we deal with issues around education, trust, mistrust, hesitating about the vaccine, and also getting them ready to take the vaccine, as well as strategies to mitigate the virus. So I am so happy that with this new administration, we were able to move at a very fast speed to get these programs out. There are more programs in the work, more funding on the horizon. We hope to fund at least 300 more. This is just not a one-time funding here, thank you and goodbye. Those 7 projects are going to be funded at the millions of dollars level for the next 5 years, and they will get that amount each year for the next 5 years. And they will be looking not only at COVID vaccine, but they will be looking at the efficacy of things like the influenza vaccine, shingles, and pneumococcal. All of those things that affect communities of color and addressing them from the community's perspective. So there are a lot of programs that we're working diligently. This task force has been working around the clock. We've been working with a lot of our jurisdiction to get this done. We've been working with a lot of our community partners. And I am so excited about these 7 partners that we funded and how quickly we were able to fund them and how quickly we're going to be able to get them up and running. So if many of you have membership affiliation with these organizations, please reach out to them because they're here to help us help you. And thank you for allowing me to share that, Maxine.
Very welcome. So Dominique had to jump off, so we can definitely go forward. Monique with the remaining questions, Benita and Dr. Akintobi and Dr. Murray, you guys are truly amazing. I'm learning so much, and it seems like we have an audience that's fully engaged. So what else is in the chat, Monique?
All right, thank you. Let me jump to another question here. For common health conditions that particularly affect the Black community and people of color, such as sickle cell anemia, fibroid tumors, obesity, high blood pressure, and diabetes, are you all seeing any research that suggests there's an increased risk in getting the vaccine for those individuals?
Dr. Murray, would you like to take that one?
Well, while Dr. Murray, there he is.
No, go ahead, Dr. Akintobi. You go ahead and I'll follow up you.
Yeah, no, I think if I'm hearing the question right, for people who may not only have, chronic conditions, but other autoimmune or special conditions like sickle cell, etc. If I heard the question correctly, are there particular risks related to participating in the vaccine trial or vaccination? Correct. I think the verdict is still out because a lot of the research and the follow-up, when we talk about longitudinal studies to see how people do, they are still in progress. We do have one researcher at Morehouse School of Medicine who was looking at COVID among those who have sickle cell anemia. Dr. Herman Taylor is leading that study, but his is really related to COVID survivorship and those with sickle cell, not specifically about how vaccine trial, how those with special conditions fare in terms of their participation in a vaccine trial. So as far as I know, the verdict is out in terms of whether those with special conditions are adversely affected. Dr. Murray?
Likewise, I would echo Dr. Akintobi's comments. The first, typically when you do these types of studies, right, you tend to take healthier individuals as a whole. When you do the larger phase 2, phase 3 studies, then you start mixing in the different types of folks and different age groups. So as a whole, but in retrospective analysis, typically certain immunocompromised conditions like lupus, or if you have HIV/AIDS, or if you're on chemotherapy, talk with your physician. Those certain types of conditions, live attenuated vaccinations sometimes are requested that people not take it, but that's live attenuated. So that's the traditional vaccines, similar to like the Sanofi or the AstraZeneca or the Johnson & Johnson. Those are your traditional vaccines that certain immunocompromised people sometimes are requested not to take, because you get live portions of the virus that are injected, and that's how your body learns. But these newer vaccines, that's one of the very novel things about these newer vaccines, the mRNA vaccines, which the Moderna and the Pfizer created. There's no virus that's injected into you. It's literally just a piece of genetic sequence that is foreign to the body. And that's the amazingness of this new technology. This foreign sequence goes into your ribosome, and it creates a little part of the virus, which is the spike protein, a little thing on the outside of the ball that everyone's seeing. And then that is what people and then that's what elicits the immune response. So those vaccines, from a technical perspective, are actually safe for immunocompromised individuals. And the thing to consider is the fact that immunocompromised people themselves, those are the people that tend to have a really severe disease. So people like with diabetes, chronic hypertension, chronic vascular disease. So it's very important that those highly susceptible people do get vaccinated.
And also at the 12:45 point on the chat, I was able to add the link to the CDC's webpage about chronic diseases and other medical conditions. So it has a lot of detailed information there that you could share with your loved ones and talk with your physician a little bit more about.
Thank you all so much for those answers. Just to quickly add to that question, what's your perspective for pregnant women? Is there an increased risk for the mother or the fetus with the vaccine, that is?
Dr. Akintobi, would you like to take that one?
I defer to Dr. Murray on that one.
Okay, great. Dr. Murray?
Yeah, there hasn't been a lot of study on that, unfortunately, as of yet. Same thing with kids, right? The kids study is actually going on right now. My son, who's 14, he thinks he's about to turn 21, but he has been chomping at the bit. He really wants to take the vaccine. I told him, unfortunately, they haven't studied it. They haven't finished the studies in children, so we're still waiting to see the data on that. Hopefully by the summer, we'll have more data in people like in pregnancy and with children under 16. So we'll have a better understanding of that. But as of right now, for pregnancy, we don't have, at least to my knowledge, any contraindications. But that's based on what I know so far.
Wonderful, thank you. And Maxine, I just want to do a quick time check. We've got 8 minutes left. Do we have time for one more question?
Yes, we have time for one more question. Can you scan the chat to see if there's any burning questions that you feel like we need to get answered? And then we will go to Seth to kind of close us. Yeah, let's let Dr. Murray wrap up the main question, because I think for me too, Dr. Murray, a lot of us are really either anxious to not take it or to take it. I know that for me, my question was, if I take it now, am I subject to getting it again and all that stuff? So, so the essence of the questions that are in the chat, Monique, are what? What is the general theme that's kind of out there right now?
I think the biggest theme is really in terms of the type of vaccine, the conditions that are the most of risk. There is one question that I would like to throw out there. I don't know if we'll really be able to have time to cover it, but we didn't really talk about this a lot. But in terms of how can we better leverage technology to help address and alleviate some of the challenges that are being confronted by people of color? I think Benita may have touched on it a little bit there as well in terms of the effort that's being made to really get the word out there and the communication and the education component as well. So
I think that's a great question for Dr. Murray because he sits on the Forbes Technology Council. And I think it's an excellent question as we wrap up the session and then turn it over to Seth, because that was one of the questions that Seth had is access, Dr. Murray, and leveraging technology. So can you speak to that?
Yeah, absolutely. It's a bit of a mixed bag. Is the true answer, and it's because going back to Dr. Akintobi and Ms. Harris McBride comments and my own comments, is that typically people of underserved communities, we tend to one of the other comorbidities of what I see low socioeconomic status comes with it.
Can you hear what's going on?
Can you not hear me?
Hold on, Renee, can you put your phone on mute, please?
We can hear you.
We can
Should I keep going?
Yeah, keep going.
Okay. So there's this digital divide, is what I was trying to say, right? Amongst low-income individuals, we see this, not access to good Wi-Fi or access to internet. So there's an issue with a technology divide as well that is a comorbid problem with our communities and communities of color. And so there are ways we can utilize it. The COVID-19 project, the CORD-19 AI project started by the White House Office of Science and Technology is a perfect, really cool example. There's a project that I worked on in collaboration with Google's Kaggle and really utilizing AI to expedite research, specifically meta-analysis, to be able to identify research from all over the world, translate in real time, and be able to identify both what the data was showing us and then gaps in the data so we can kind of identify those. For education, though, that's really the key, right? My personal opinion is that since education is the most important thing, we go back to all these things, even the systemic inequality usually comes through fear of not understanding people that are different. Whether it's gender, whether it's race, whether it's color, it really comes and it stems from generations of fear due to lack of education. And if we're going to use technology to educate, then it's going to have to be multifaceted, just like the problem is multifaceted. So utilizing new types of technology to identify where these groups are, so AI can be used to do that, to be able to identify the true number of individuals and the true number of infections. That's one way that technology can be utilized, and identifying where these pockets are of people that might be fearful of receiving the vaccine, and how best to potentially target them using a combination, as Mr. Wilkins described, using influencers, using the internet to be able to reach individuals, and kind of the newer types of technology. You can even throw in some cool things around VR and AR, right? Virtual reality, augmented reality, to do educational things. I know in Asia, I have a group that's working on, they developed this really cool VR game for little kids to be able to have them feel like they're superheroes when they go get their vaccine. And that's, anticipation for kids in the future. And they've been doing this for other vaccines, not for COVID-19, but they're translating that. So be able to do that, be able to story tell and educate. But because of the digital divide, that's where you need to also focus on campaigns that aren't, fancy and all the whistles. One really good one is something that we've all probably experienced due to the recent election, is through these SMS applications, right? SMS is something that is all over, and many people have cell phones that can receive like WhatsApp messages or other types of SMS messages. The Clinton Global Initiative has a great educational campaign for Hispanics for early childhood development called Pequeños y Valiosos. In Spanish, it's a collaboration with Univision. My group at Astra, we provide STEM content for that. So those types of educational programs, I think, are also important. So you can use high tech and reach certain individuals, but I also stress all the time that don't forget low tech. Low tech is also very important when you're dealing with communities that come from a lower socioeconomic status, and also reaching them in their communities. You have, specifically with Hispanics, if you have people that are working the fields, like reaching their community centers, creating pop-up tents where they live, going to the places that they tend to do their laundry or where they go to worship, utilizing these central hubs that are integral to the humanity of these societies. I think that's the other major component. So although I'm a huge technophile, I also am a strong proponent of combining humanity with technology and trying to come to a good solution that's for everyone, because we often forget that the digital divide is a real inequality that we still have with our communities.
Oh my goodness, you are certainly a man after my own heart. I love all of your ideas relative to technology and innovation, and including the humanity component. That is absolutely awesome, awesome, awesome. So Monique, anything else before we turn over to Seth?
No, not at this time. Thank you, audience, so much for your engagement and participation. We can hand it over to Seth to close us out.
All right. So Rebecca, thank you so much, Monique. I appreciate you and your directorship and managing our chat. Rebecca, can we go to the next slide and Seth? There we go. Seth is, like we said earlier, he's the founder and CEO of Therapeutic Systems. He's also one of the leaders at Tag Digital Health. And Seth is going to close us out and share with us our call to action. Next slide, please, Rebecca. Seth, I'm turning it over to you.
Hey, thank you. Can everybody hear me?
Yes. Yes, we can.
All right. Rebecca, next slide, please. As we close it out, first, wow, this was an outstanding 90 minutes of great insights and conversation on such an important topic as the impact of COVID, especially in the community of color. So I want to thank everybody on behalf of TAG Digital Health and TAG DNI Society. I think this has been a great event, and also thank all the attendees, sponsors for being part of this event. So before we leave today, just wanted to remind everybody about these few calls to action and notes. First, vaccination is a community service, which is very greatly said by Dr. Corbett. Also, when you get vaccinated, please remember that you're not only protecting yourself, but we're also protecting our community. And to reach a level of herd immunity, we got to get to about 60 to 70% of the population being vaccinated. So we are quite far from that. So obviously, we encourage everybody to go in and take the vaccinations. And even if a person has had COVID before, they should get vaccinated. De-risking should be the science behind the policy decisions that are made. And also, if you get vaccinated, please, you should continue to wear your mask, wash your hands, and watch your distance, the 3 W's. So thanks again, everybody, for joining. And I'm going to turn it over to Maxine. Great event. And thanks again for everybody to participate and attend this event.
Thank you so much, Seth. And I'm going to go back to Adam Moore. He and I definitely share a lot of the same concerns around what's going on. And he and I also sit on the same board. He's the chair of the Diversity and Inclusion Society. And this was really a really, I would say, passion project for us to do this. Yes. But more importantly, Adam is actually suffering with COVID as we speak. And so as we close out, Adam, what has this done for you personally to participate in this event? And do you feel like we accomplished what you set out for us to accomplish with the event today?
I do. Thank you so much. And I think, when we first started talking about this and we were speaking with the Digital Health Society about putting this on, for me, making sure that we got the message out and we were reaching back to communities who historically may not have a lot of trust in vaccinations. You can look at historic references, you can see all the different factors that point along to it. And we really have to, as a society, this is not just a one color problem. This isn't just a one economic status problem. This is an everybody problem. We all have to link arms. We all have to join together and work together to make us all safer, and so that we can move forward and repair the economic damage also that we have going on too, right? So this isn't just about us getting healthy. This is also putting our country back on a path to greatness. This is about putting us back on that path to prosperity, to make sure to quote some of our other great presidents, to make sure there is a chicken in every pot, if I'm going to look back at some other inaugural speeches. This is that path. These are the steps. These are the ways to do it. This isn't just a nice to have. This isn't just a, wouldn't that be great? It's not a pie in the sky thing. This takes an effort from everybody. And the panelists and yourself and everybody else has demonstrated clearly, we all have to work together. For my family and I, working or fighting through it, you know, when we go back and we try to do contact tracing, we're trying to figure out where it came from. We wear masks, we wash hands, we sanitize. So folks, guess what? When they say it's highly communicable, it is highly communicable, and we have to be cautious. To be sitting where we are, we're a little kind of stunned. But I'm going to tell you, to hear this type of promise, to know that we are all working together, it makes sitting here right now just such a wonderful thing to hear this message put forward. So if there's anything else with this call to action, everything else, everybody remember, it is, we all have to link arms and we all have to work together to make sure that all of us are healthy moving forward.
Wow, thank you so much, Adam. I want to give a huge shout out and thank you to all of our panelists. We thank you for your time. We thank you for your insight, your expertise, your passion. I cannot thank you enough. And we all have to make sure that we are adhering to the 3 W's. As Seth stated, we need to wear our mask, we got to wash our hands, and we have to watch our distance. And I would encourage everyone to get the vaccine. I'm definitely looking to get my vaccine as soon as possible. Adam, our prayers are with you and your family.
you.
We hope that you guys get through it.
Thank you.
We know that you're going to get through it. That's a better statement. We know that you're going to get through it.
Thank
and
you.
I want to thank everybody for coming out today. Have an awesome, awesome afternoon, and spread the word that vaccinations are a community service.